Good morning.
Morning.
Just rearranging some mics here, I'm sorry. How are you? We'll let you get set up. How are you doing? Jay, is that you back there? Let me know when everybody's ready. You ready, Cliff? As long as you're ready, Cliff, we'll just get started. Again, good morning, everyone. I'm County Executive Anthony Pacenti, and welcome you here this morning. I'm joined here at the podium by the Director of Public Health for Oneida County, Phyllis Ellis. Also with me in the audience, there are County Legislators James D'Onofrio, Anthony Leone, Brenda, I couldn't see Brenda McGonigal back there, I thank you. Cindy Rogers-Witt, and also joined with representative from Assemblywoman Marianne Buttonshawn's office, Dana Olney, Gerald Peterson from the Office of Homeland Security and Emergency Preparedness, Sam Madison from the Governor's Office also is with us today. Thank you. So let me start really at the beginning, from the very beginning when Corona was identified as a virus, as is with every other public health issue. Our public health department was engaged and has been engaged from day one with this and obviously any other public health issue over the last years, and this is what we do each and every day in county public health, whether it's H1N1 from years ago, whether it's Ebola, whether it's influenza A, B, whatever the case may be. Our health department is the lead in Oneida County, working hand in hand with the state government, the state health department, and obviously our federal representatives and our federal health agencies in terms of anything that is dealt with that has the epidemic proportions that this recent virus has exhibited throughout. So we were engaged from the very beginning, and our health department has been daily on calls with state health, gathering all the information just as everyone else has, and working throughout this county and with all of the partners and all of our partners in healthcare to assure that a system was in place. Now, let's talk about the issue that brings us here today. Just a few days ago, 2 individuals returned from a trip from Italy. The individuals were physicians. They followed the proper protocols upon departure from Italy and arrival in the United States, notified our health department. It wasn't until the second day that one of them experienced some symptoms of flu-like symptoms, let me put it that way. Immediately, right after that, we were notified at that point. Immediately, the individuals were both tested. The test results were then hand-delivered to the Wadsworth Laboratory in Albany in coordination with the Oneida County Public Health Department, the State Department of Health, the Governor's Office, and my office. I want to thank the Governor's Office, the Governor, for his leadership in this and working with us in tackling this issue on a daily basis throughout the state. And clearly this is something that we're going to be dealing with for a while. So the results, or the tests were carried, as I said, to Albany last evening, and early this morning we received word that the results were negative for both individuals. And the Governor did make that announcement along with others, as he's done on a daily briefing throughout this crisis over the last several days, as there were other tests, obviously, in other parts of the state that the good news is they came back negative. So before and Phyllis is going to go through some other pieces of this, but let me just talk about the system for a moment. That the system we have in place in Oneida County worked and has been working because, as I said from the very beginning, we have been at the forefront of this crisis, dealing with our partners on the state level and leading with our healthcare professionals throughout this community. The system worked because people got tested immediately upon evaluation of these symptoms and the circumstances as which they were occurred. Now, I will stress, and again, I'm going to let Phyllis deal with more of these issues, and I just get to bear with us. Remember, we are still in the midst of the flu season. Influenza A and influenza B are still prevalent, and they're still a big part of what people are dealing with. Yours truly, I just got back. Today's my first day back after about 2 weeks of having influenza A, so I can be one who can tell you what it's like. It's not very pretty, and we're dealing with that throughout this community and throughout the state and the nation in terms of what we have in terms of influenza and other types of viruses out there. The system worked in this place because, in this case, because people were evaluated. It is not a mere test for corona. Until that could be done, obviously symptoms have to be exhibited, and the contact or the travel issues of which corona has been identified has to be clearly identified in these individuals before anyone is tested. So when people are sick with the flu or feel flu-like symptoms, it is not a corona test unless and if those persons were in contact or were in travel in those areas that have seen that. And we've heard that through our federal government, through the president and the CDC and the experts on the federal level dealing with this, and as well as the governor and the state health director and throughout. So, when dealing with this, I mean, there are protocols that need to be followed. It is not just that everyone with flu-like symptoms are tested for corona. There has to be a specific evaluation done on each of these individuals, and pending, where they've been, what they've been in contact with, and how that comes to be. So I think it's important for all of us, and that means on the county level, in all of our medical institutions and healthcare professionals, to be responsible and to be transparent, and I call on everyone to do that. We need to let people know what's happening out there so that there's not panic, so that there's not undue stress when these cases do occur. Let me be very clear, and it's been said, and this is not from my words only, but from the president, from the CDC, from the governor, and others. Obviously, we're going to see a case somewhere along the line in any community in New York State or any community in the United States. There are people who work in this community, in this county, that work in other areas. There are people who visit this county from other areas for work. The chances of another person being tested is very high. We don't have anything at present, but clearly we're seeing, throughout the country, people returning from abroad, whether it be students, whether it be professionals, whether they be in contact with different types of individuals throughout their work contact, or where they've been or where they've traveled. And so with that, there will probably be another test at some point in this community. And I just want people to be aware of that. We want everyone to be aware of that. We also want people to be aware that there are other issues out there. As I said, the influenza. Phyllis will go through obviously what we've been telling people and what we tell people each and every day, especially in flu season, which usually occurs in the fall and throughout the winter, of the simple hygiene of washing your hands, of being careful with contact, of wearing a mask, when around people, or if you have exhibited or in contact with someone who is sick. Clearly, this, as has been said on the federal level, this virus, just like influenza and others, is much more severe when it is in people whose systems have been compromised, be it the elderly, be it heart patients, patients with diabetes, patients with other health issues. Clearly, getting the flu causes more stress. That doesn't mean that a young individual can't be struck down with this or won't, but there is obviously that concern, in more vulnerable of the population. So again, the message today is, the good news is the 2 individuals that were tested were negative for corona. That means that the circumstances do not require the extensive type of testing with others at this time. We will continue to monitor that. We will continue to look at any other symptoms of individuals that may have traveled or may have come in contact with people who have traveled or have had issues. But right now, the good news is we have 2 negative test results. They are the only test results also that have been conducted for an Oneida County resident. Correct. At this time. As has been previously reported, we did have an individual a couple weeks back who returned from China, who was monitored and was self-quarantined, but did not exhibit any signs of an illness or any signs of any distress or flu-like symptoms. So that person was not tested. It's important to know, and it's important for everyone to know, and this is where we need the media's help in all of this, in keeping this open and transparent, as I continually say, that we monitor and we follow the guidelines of what the CDC, what the federal health officials and state require, and we continue to do that. People are not just randomly tested. There has to be circumstances that are warranted for each individual case, if the case may be. Again, I stress these were the only 2 individuals to date in Oneida County that have been tested for corona specifically. So that's important to note, and it's important that people are aware that the negative declaration is positive for us. However, we still caution people, and we still want people, again, we still know that there are other, again, influenza is still rampant out there, and something that should be dealt with accordingly. We are continuing our communication protocol with our local health providers on a daily basis, and we'll provide updates to the media and to the public as necessary, as we continue to look and see if there are any other cases out there. Again, I stress right now that we don't have any, but that doesn't mean that one would not be coming down the pike. I'm going to turn it, before we take some questions, I'd like to turn it over to Phyllis Ellis, Director of Health, to run through some of what we've been dealing with and what her guidelines are in terms of this virus and everything going forward. So, Phyllis.
Thank you, County Executive. Good morning. I'd like to thank the County Executive, working with the Oneida County Health Department, our legislators, our department leads in Oneida County, and of course our Oneida County Health Department team members who have been working very closely with our community members regarding this coronavirus, as well as other diseases, as the county executive said. And thank you for allowing us this opportunity to work with you, the media, today to talk about what the condition is in our community right now and how we share this information, what information the community needs, and how you as our media partners can get those facts out to our community. So we're fortunate and grateful that our two potential cases are negative today, and it's wonderful news. Please be advised that because they were suspect cases, there are patients under investigation, we call them in the health department world. So they will be self-isolating for the 14 days of isolation that's required for persons that have returned from one of the 5 countries that are now under travel advisories with New York State and the United States. So they will remain on this voluntary isolation. We will be monitoring them on a daily basis. If anything changed in their health, we will notify our state health department and move forward from there. Again, Oneida County is prepared. We've been prepared for many, many things in our community. We, as a local health department, work closely with our New York State Department of Health and our community partners to prepare what we do and what we have to do if there was a positive case or a negative case. The virus initially, as you all know, was detected in Wuhan, China in December of 19. Since then, it's spread quickly to various countries, and now it's worldwide. The information that I'd like you to take back is that this information changes daily and multiple times a day regarding what, who is exposed, what countries is it next, how many people have been confirmed. It varies from state to state, and I couldn't quote you numbers today because they change probably hourly as to what's the total number in the United States and where are they in what states. Obviously, on the CDC website, you could see maps, and if you're really interested in where it is, you can find all that information. The other important thing to know is that the majority of people who are exposed to this virus or may have been exposed to this virus will have no symptoms at all. So if you're young and healthy or older and healthy and you have no medical history, you're not compromised, you might have been exposed to this virus and you will never know. Just like the flu or like any other viral illness, that if you're healthy and you are exposed, you will not be sick. You can't say who will be and who won't be. The small amount of people that might be severely ill that you read about and hear about on the national news are generally people that have been immunocompromised, they have chronic illnesses, and their bodies can't fight the viruses that a healthy person can. So we want you to be aware that we're going to share information as best we can within the constraints, of course, of our HIPAA regulations. We will not be giving names of patients and where they live. We did have calls like that when our first case came back to the States. So that's a privacy issue and a HIPAA regulation for health departments. So what we really want to do is avoid any misinformation out to the public. So if you have questions, if the media has questions and you're not sure about the answers, please give us a call. We'd be happy to clarify things for you so that you can help us get the correct information out. The Oneida County Health Department, as any local health department in New York State and around the country, has responsibility for identifying potential cases, testing, tracking, and monitoring movement and their travel within Oneida County. And we have to do an extensive interview and work with those patients that are coming back from those 5 countries to determine where they've been, who are they exposed with, and where are they now, what are their symptoms. Based on all that information, we confer with New York State Department of Health, who determines if the guidelines have been met and the criteria is met to be tested. So I hear a lot of information out there saying we should all go to the doctor and get a test, and do they have the kits? There's no such thing as a kit. You are not going to go out to your doctor and say, I want to be tested for coronavirus because I coughed today. All the symptoms, if you've been exposed or a traveler or meet a certain criteria, you will work with our staff at the Oneida County Health Department. That information will be relayed to our senior partners at the state level, and that determination will be made, as the county executive said. The test will be done locally, transported to the Wadsworth lab, and the lab results will then, in turn, come to us. So it's not a test like you can go to your local physician and they do like a strep test or a influenza test. And part of that reason is they're still testing a lot of what the coronavirus is. There's not a treatment for it right now. The Tamiflu that you got for the flu is not going to work for this virus right now. So until we have a vaccine, right now this is the protocol. And I want to stress that that could change from the time we leave here today till this afternoon. All the guidelines come down from CDC and New York State Department of Health on a regular basis. So what can we do in the community? What do we want to tell people out there? What can we do to protect ourselves from potentially being exposed to this virus, any other virus, the flu, the spread of any communicable disease? And the message is good health hygiene. Cover your cough with your sleeve. If you use a tissue, wash your hands afterward. Hand washing is the biggest prevention item that you can do. If you have kids, the messages that we're getting to schools, we have schools calling us, before the kids sit down and eat, have them all go in and wash their hands. I mean, they touch everything in the world in school, especially little ones. Social distancing. If you don't feel well, you've got even a cold, your normal symptoms that you have when you don't feel well, don't go to a party. Don't go out to your friend's house. Stay home and get yourself better, like you did. Stay home if you're ill. If you're ill, work with your employers. You know, you don't want people to come to work sick. We've been saying this ever since the flu season started. It's not unique to coronavirus. Our flu season ends probably not till May. It started in October. It's a long season. If you didn't get your flu shot, they're still out there. Please get them. They're still effective. So what do we do in public health? Why does the county executive say, you know, public health does this? We prepare for any potential issues in public health emergencies, and the county executive mentioned all those that we have done in the past. We do emergency planning with our emergency operations staff and our community partners to determine how people are handling whatever the issue is and how we prepare for it and how we ready ourselves to determine to kick in our plans. We're extremely fortunate to have resources from New York State Department of Health, the Centers for Disease Control. And I believe if you don't get it today, we'll send it out through our communications people here at the county. Links in our press release that will link you to the cdc.gov website, which has links for every kind of specialty concern that you have. If you're a school district, a superintendent, there's a guidance document for how you should plan at your school. If you're a daycare center, if you're an elementary school, if you're a college with your returning students. The CDC and Department of Health are having daily webinars for those different sections of the community to talk about what do you do, what are you looking for, and here's the guidelines that you should be following. People have questions about those, they can call us, we'll walk them through that, but they're available on the public website at cdc.gov. And there's a whole list of guidelines for every sector in the community. If you've been away, if you have a history of travel to one of those 5 countries that are listed as widespread disease, monitor yourself for any kind of respiratory symptoms, cough, shortness of breath, fever, which is an important piece. If you don't have a thermometer, that's the one thing you should be running out to get, not your masks. Monitor yourself for respiratory symptoms, shortness of breath, cough, fever. If you have those such symptoms and you've traveled to those countries, you should be calling, not arriving, calling your healthcare provider, your physician, your nurse practitioner, your physician assistant, whoever sees you for your care. Tell them your symptoms, give them all your history. They will refer that to us. We will be contacting you by phone to tell you we're from the health department and we'd like your information about your travel and your contacts and your exposures. That information will relate to state health and will determine if you are a candidate for a test or not. Do not present to your urgent cares. Do not present to the emergency departments or your doctor's offices. This is going to overwhelm the system. Plus, if you are sick, you're going to contaminate everybody there. The process won't move quickly for you. You'll sit for hours waiting to be seen and then only to say, go home and we're going to have the health department call you. So triage that by telephone. If you're extremely ill or severely ill, obviously you're going to seek emergency services, and that's not what we're talking about. We're talking about people with upper respiratory symptoms and fever. Call your provider. That will trigger the Oneida County Health Department investigation. The other message to the public is that the use of PPE, which is personal protective equipment, is not necessary for the general public. The media has gone crazy with the everybody looking for masks and they can't find them and they're charging 3 times as much for the ones that they have. The general public is not protected by those masks, and those masks need to be saved and resources used for the healthcare providers in facilities that are going to be caring for the patients that are positive for coronavirus that are very ill, to protect the staff at the hospitals and the healthcare facilities. So those are the limiting factors for PPE. In closing, I just would like to remind you that we're planning, we're always prepared. This is what we do, as the county executive defined. We're grateful to New York State and the CDC for all the help that we've been given. The governor has been extremely positive on this note to work with all of our counties, and his staff has been extremely helpful to us. We'll continue to release information as we get it and as it's accurately defined. So we won't release information until we know it's confirmed and it's accurate. If you have questions, please contact us and we'll alleviate some of the facts you might be hearing from outside somewhere else. We'll work with our state and local partners to isolate and monitor and track patients that are coming back that are not symptomatic that may have to be monitored for those 14-day period. I think that was it.
Before we open the questions, just really again stressing, obviously Phyllis did an excellent way of explaining the process, but also what people are dealing with or what they could potentially be dealing with and how to deal with it. I guess one of the important things that she said, or obviously all of it was very important, one of the key points I stress and that we have stressed is that this is ever changing. That, as she said, that what we talk about today in terms of the countries, in terms of the symptoms, in terms of the care or whatever, we've known is changing minute by minute or hour by hour, and what is happening. So things could change. There could be other countries, there could be other areas, there could be other symptoms that could come up as we deal with this. It's something that's an ever-changing process and just an ever-changing disease. So I just caution on that. But again, heed the words of advice that we're dealing with. Unless you've been in those 5 countries and in contact your health care professional first. Do not just walk into the doctor's office. I mean, I can tell you that firsthand. Stay home. I mean, it's really, they could tell you around here, hard for me to stay away from this place as much as I love it each and every day, but my other concern is for the people who work here. I cannot come into an office, when I was sick, and that's what you should not do, and people should not do. If you're sick, stay home, get better, before you get back to work and infect other people. So all of those things are important, and at this point, we'll take questions, and I know David had his hand up way before everybody, so.
So these were 2 physicians?
I identified them as such, yes.
And did they work at the Rome MDS Medical Center?
I will not confirm that.
But they were physicians?
They were physicians, yes. Go ahead.
Did they see patients or go back in the office and say they're back?
I beg your pardon?
Did they see patients or go back to their offices and say they're back?
They did.
Okay. Do you know how many or how many people might
I
be?
do not know that number. No.
Will those be the people that you kind of referred to that would be in isolation that you're watching? You kind of alluded to something along those lines.
So those 2 patients that came back from a European country that was on the list, because of their symptoms, are going to be monitored and self-contained in their home for 14 days, monitored by Oneida County Health Department. Okay? So did they see patients? I believe they did. Once they determined they weren't well, they stayed home, which I believe is, the rationale for not seeing patients in their office the next day. And, when you think about that, probably many physicians in their practice see tons of people a day. So if they're not well, they don't want to spread anything, whether it's the flu or cold or anything, to their patients. So with good common sense, practitioners would not be working that day.
Let me try and broach it from this point. So the fact that these are negative for coronavirus does not require that the people that were seen in that office at this time be tested or even be evaluated.
Right.
I think that's probably the answer or the question that we're all looking for. I mean, had Had it been positive, we would be having a different discussion today about what took place. It was negative, so we don't have to deal with that from that point of view right now. I mean, it's like look, as doctors and nurses, and whether it's in a professional office, private offices, or however, hospitals, emergency rooms, they're seeing sick people all the time. They're susceptible to, and vice versa. So, but in this case, we do not have to monitor any of the patients. We do not have to test any of them. We have a negative result here, and that's what the point is. Jay?
Those two individuals that had the negative results, will they be going through a second round of testing?
No, if they were positive, they would when their symptoms subsided, but they'll just be going through the 14-day monitoring with us. If any symptoms increase or change, then we'll contact our state health and determine at that point. And again, I think moment to moment with guidelines, they will change, but right at this moment, no, we'll be monitoring them for 14 days.
And after that, they're out of the woods then? Because it sounds like they're not quite yet. Like if they continue to be symptomatic, they could feasibly test positive after this negative test?
They wouldn't be retested unless something else came up that's not currently showing now. Like with anyone, if you came home and you had the flu, you were sick, you didn't get tested. Is that what you mean?
Well, no, what I'm saying is, so they've tested negative, so there's no chance in 2, 3, 4 weeks they would test positive unless there's a new exposure? Like, are they out of the woods or not?
At this moment, that's the most that we could presume. And as I said, if CDC and state health give us any further guidelines, then they would change. But I think in reference to the retesting, I believe at this point it's only if it was a positive test with patients symptomatic, when their symptoms went away, they would retest them until they're negative.
So this was a situation where the two people, they were
Travelers.
in Europe, they're physicians, they came back and sort of as precautionary,
One of them.
they're in the field, they decided maybe that
One of them exhibited some type of symptoms, which triggered the protocol, the criteria to get tested. And because they traveled together, obviously, and then the other one had not exhibited any symptoms, but was tested because of the closeness and because of the travel together. So that's why those two were tested. One exhibited symptoms, the other one did not. So the point here is, in terms of that 14-day period, having come from the doctor, it's the same thing I heard. It's if things change in the time period, then you go back and if you get reassessed. If the symptoms continue, if there's one of the symptoms continue and you can't get rid of it, it's not unlike any other influenza in that regard. So it's really a monitoring thing, and people and doctors will tell you that influenza, if that's what it is in this case, since we know it's not corona, takes a good 10 to 14 days to clear out of your system or to be feeling better.
So is it safe to say that if you haven't traveled to any of these 5 countries on the list and you haven't come into contact with any people that have traveled to these 5 countries, that you don't really have to worry about it, or is that something that generally everybody should be?
No, I think that it's been stressed on the federal level even strongly. I mean, this is not a concern for every individual in the country that you're going to catch this, and unless circumstances present themselves as such, whether it was that travel, whether it was in contact with someone who was traveling, whether those 5 countries in this time period of probably since December and when this was first expressed. But if that travel took place 2 months ago and there's been no symptoms, I think then that I can.
And I think one of the points to your question is what I was trying to stress about community spread. Is with any virus, those prevention activities are very important because the goal right now is to prevent community spread. So you may not know if you've been in contact with someone who was in one of those countries. Right. So the washing of the hands and the prevention issues are going to help you stay away from that virus if, in fact, you end up with somebody that you don't know traveled. Because there's not always the chance that you may know 100% who you've been with. So the prevention is the key.
Glenn?
I have a follow-up question. So you said that they followed all proper protocols. Is there no protocol for a doctor returning from one of those countries to wait and see patients? There's no waiting period, just you come back from Italy and start seeing patients? Boom.
At that point, the guidance was if you were symptomatic, and they were not.
They were not symptomatic when they came
Has
back.
that changed?
The only guidance that's changed right now are students returning from those countries. College students that are returning, they're going to be monitored for 14 days.
So not doctors who
No, it's
Not unless
not
they have
today.
symptoms, not unless they're symptomatic.
And didn't you say that you had identified and are in contact with people who have returned from those 5 countries, like now?
Students?
Anybody?
We've been talking on the phone with a variety of colleges and parents of students that are returning back from those countries, yes.
Any of those symptomatic?
No. Jay?
In that 14-day period, you used the word voluntary quarantine.
Yep.
Can you describe like the parameters or?
Okay, so if you fit the criteria, much like our person originally that came back from China, you met the criteria for those high widespread areas. Now they've increased to 5 countries. In the beginning it was just China. Once you identified that you were there and you have no exposure that you know of, like these students, they're going to be monitored for 14 days, which means voluntarily you will stay in your own location, whether it's your school or your home, with private bathroom and bedroom, so that you can isolate yourself from the rest of your family. We will be monitoring you twice a day. You'll be taking your temperature, your symptoms, calling us back and forth. We'll be contacting them, texting, calling, FaceTime, a variety of methods to speak with those people. Generally, and up to this point, anybody that we've had to do that with, which isn't a lot, has been very welcoming to that. We have agreements with the patient, legal agreements that say what they need to do and what they shouldn't do. As a public health department, we're also responsible to assure that the person that's in their home alone has access to food and medication and anything that they need on a daily basis, so that we would have to coordinate that if the person lived alone and couldn't get out to get their food and that kind of thing. So all those psychosocial issues that happen for someone in 14 days, even if it's in your own home, is pretty, devastating to people if they can't get out and do their normal business routine. So that's another role of public health.
This morning the governor mentioned that SUNY and CUNY students returning from some of the watch list countries are going to be housed at locations here in Utica and Rome, or in Oneida County. Do you have any information about that or exact locations for those?
I believe those are their own schools. So we've been communicating, and yesterday there was a webinar for the higher education communities. So most of those students who have been abroad, they're suggesting that they come back to their school campuses and isolate and monitor there and communicate with us on their monitoring. Some, we understand, will go back to whatever state they're from and probably go home. So, we'll be communicating all that information through our state health department. So once the people leave our county, the state health department sort of monitors and tracks and meets and speaks with local health departments in other states. Thank
Do
you.
you know how many of these students you're in communication with who, simply because they recently traveled from one of the 5 countries that you're, watching and that are maybe self-isolating right now?
How many?
The numbers, no, I don't. We've been talking to people daily.
Can you just check those 5 countries again?
Okay. China, Iran, Italy. Oh, it's on the CDC website. China, Japan, Iran, Italy.
South Korea.
There's 5.
Right.
And they have the travel advisories on the CDC website, so some countries are absolutely don't go. And then there's, I think, one that says highly suggested that you don't go. So they have levels from 1 to 4 on CDC for those countries.
Once you test negative, why do you need 2 weeks?
That's the structure of the health officials and the protocols they've set up by CDC. And it's probably, as the county executive said, it's probably right in line with other flu-type virus symptom, how the symptoms of the disease progress. So if you were going to get sick, it probably would be in that time frame. And again, there's no medication that you can take. Symptomatic treatment if you're not feeling well, like the flu, There's no Tamiflu at this point for coronavirus, so all that is being worked on a national level and international level as we speak.
Any other questions? Yes.
Yeah.
Could you speak a little bit more about the monitoring and who qualifies for that and what that exactly looks like?
The monitoring at the home is for 14 days, and the patients that return would be interviewed by Oneida County Health Department, and we would ask them to monitor their temperature twice a day, monitor any symptoms they have, cough, respiratory disease, shortness of breath, difficulty breathing, to contact us right away with any of those symptoms. Otherwise, we'll be calling them and checking twice a day on those symptoms.
Okay, and is that those who qualify for monitoring are also those that have come from those 5 countries?
Mm-hmm.
And so that they would qualify for
Right.
even if they aren't yet symptomatic.
Right.
So we'll be monitoring. Okay.
So you're counting on people to be honest and tell you?
Yes.
They're telling
Yes,
us.
They're telling us.
They're telling us.
Or do
I
you
mean-
know?
I mean, we'll wrap this up, and then obviously, if you want to talk to us, we'll be available. Obviously, there was a lot of information disclosed today in terms of the recent testing of individuals, and also, as we deal with corona, and as we deal with all aspects of public health. And I want to commend and thank Phyllis and her staff at the health department for the great job that they've been doing with this and continue to do. Again, thank our partners in state government for working with us so closely in the governor's office on this. I'm going to stress a couple things to the public that we want them to know, that we have a system in place, and in this case, again, as I started this press conference earlier, the system worked. The protocols, the issues that we had in identification of a possible case was handled immediately, tested, returned, and disclosed. Those were the only 2, again, that have been tested right as of this moment, as I'm standing here in Oneida County. We will continue to keep the public abreast of any other issues. We thank the media. I want to thank them for their cooperation in this, and their help is essential, as we do not extend or exhibit, false information, or anything that would panic the public. So to all Oneida County residents and visitors, we have a great system in place and have been handling this and will continue. And I stress again, we will continue to work with our health partners throughout this community, the hospitals, the healthcare providers, physicians, caregivers, and working throughout with our schools, all of our institutions. This is an issue that we have, as like every issue, we deal with immediately and take very seriously each and every day. We'll continue our daily calls with the state and notify if there are any other changes. We'll continue our outreach and our public information. Again, if you have, as Phyllis has said, traveled to any of those areas, come in contact with anyone. Contact the health department. Start there. If you have symptoms, contact your healthcare professional immediately. Do not go into those offices if you have symptoms and have been returning from one of these areas. We'll continue to be open and transparent, within the confines of HIPAA that we have to follow. But I want everyone to know that we are clearly in the forefront of this and have been from day one. We'll continue to lead and we'll continue to inform everyone what is happening in Oneida County. Thank you.
Thank you.
So those locations, we just say Oneida County